Laura Arrington, Rowena Blackman-Shroud, Kiko Franco, Edison Bond, Ed Drummond, and Philippe Abraham. So without further ado, the person that makes this happen, the person that charged us to work on this assignment that we really just enjoy doing is our beloved statewide president, Fred Cole. So I'm delighted to introduce our fearless leader, Fred Cole. Thank you.
Thank you, Patrick. I think I appreciate the kind words, Patrick. It is a case, though, that I'm going to reply in kind. So everyone knows Patrick Romaine has just been an amazing, contributor to life at the University of Albany and beyond the University of Albany in his role with the Educational Opportunity Program. And beyond that, a constant presence in advocating at the state legislature for the benefit of our students and for those who are a part of this great union, United University Professions, the largest higher ed union in the country, and one that has always prided itself. As Patrick listed those giants in our history, that reflects UUP's historical commitment to racial equality, civil rights, individual liberties as a core principle for our being, literally. UUP, I believe, has always tried to be more than a union. If a union is simply negotiating a contract and trying to get benefits for its members, as important as that is, that's not enough. Not now, not ever. And so as we are educators and healers and researchers, we are engaged in the work of the future and in building a better society through the students we educate, through the patients we heal, and through the research we conduct. And so it is incumbent on us as a union to embrace the work of justice, because what is a future if not the place where there will be more justice, more equality, and a better opportunity for all to truly reap the good things of life. So that is as a means of introduction, and certainly Patrick and Darlene Mayer, the co-chairs of our DEI committee at UUP, just done phenomenal work, and the staff, in this case, led by Danielle Judge Freeman, who has done remarkable work, along with others, to help facilitate what is, in this case today, our second program. The first program last week really kicked us off well. It's a very powerful, very energetic set of presentations. I just enjoyed it. It energized me, and I'm proud again today to join with Dr. Threatte and with Dr. Camille Clare from Downstate to discuss this important issue of vaccinations within the African American community. But I just want to say that all of you who have joined us, and I thank all of you who have joined us, everyone needs to understand that this is a second panel. Another one is coming, and that is to coincide with Black History Month. But this is all just a kickoff to what I refer to as an unending journey, a journey to racial justice, which literally must overcome over 400 years of racism just in our nation alone, specifically targeting African Americans. And that work is both intended to address the racism in the society around us, but also the racism in our own structures, in our own organization. That's why it will take a long time. That's why what it's going to take is a lot of self-examination and a discussion amongst ourselves and a confrontation, really, of those things within the labor movement, the worker movement, and yes, in UUP itself, where racism, whether intentional or not, has reared its head and has had long-term impacts on who we are as a union and what we do as a union and as human beings interacting with each other. We also have to address the long history of racism within SUNY itself and higher education and yes, our society. It's a big job, and I think it will take a long time to overcome. This work will not be completed, I dare say, by anyone gathered here today, but it is absolutely our moral imperative that we have to do this work in order to be true to ourselves and to be true to those who come after us. And as Patrick put so eloquently, the giants on whose shoulders we stand. What I wanted to just reflect on momentarily before I turn to our two speakers is COVID, and how COVID has exposed so much about the world in which we live. It is rooted in very basic terms. It is rooted in environmental injustice. The fact that human beings are going into areas of the natural world that they ought not to be, and with extreme poverty and deprivation, people are seeking food and land where they are encountering. I'm no scientist of that kind, but where they are encountering viruses and diseases that have been previously unknown, that now have reverberated back on us in the case of COVID-19. Having said that, what COVID has exposed is our vulnerability to such pathogens. But more importantly, I think, is that it has exposed how fragile our institutions are, political institutions, healthcare institutions. But then also, it has exposed the racism in American society and the economic and social inequities that have lasted for far too long. Let us all look back and remember that when COVID hit in February, now 2 years ago, and cases started to escalate in March, in April, in May, they were here in New York State, but specifically they were in New York City. They were overwhelmingly in communities of color. They were in Brooklyn, they were in Queens, they were in the Bronx, they were in communities of color. That's where the impact was first and worst. And we all, in a sense, have kind of forgotten that, unless we're directly involved in this work. It's like we have moved on to other discussions, vaccinations and so on and so forth. But the reality is the cost in lives and in loss itself to our fellow union members, our fellow community members, specifically from communities of color, have left real wounds. But most of all, it's exposed the racism in our society, in where people are forced to live, and in the poor healthcare that is afforded those overwhelmingly in communities of color and in under-resourced communities. That is one of many reasons, but I will tell you on a personal level, it is why I have fought so hard in my now nearly 9 years as UUP president to sustain, to grow the institutions which are our academic medical centers, and specifically the teaching hospitals at Downstate, at Upstate in Syracuse, at Stony Brook. These institutions are so vital because they provide healthcare that individuals in these communities may not get anywhere else, but also there is research that is going on there, important research, and there's education in the development of the next generation of healthcare professionals that now magically people are all discovering, oh yeah, we've got a shortage. We have known this for years. We have called for attention to this for years. Now we're in a pandemic. Now the resources must be delivered if we are to be prepared for future healthcare emergencies, but more importantly, to provide the long overdue, fair and equitable healthcare to those who have not been receiving it. And that's why I honor the work like Dr. Clare, and in his previous career, Dr. Threatte at Upstate, the work that people do and have done at these institutions in healing, in research, and in education. This is the time, if I can hit a common note that I strike these days, where we must advocate for our hospitals, our members who work at those hospitals, the patients that are healed there, because we all benefit from this. The future doctor who treats us and our families, the healthcare we receive, and protection against the spread of deadly diseases. All of this is done at these institutions. And it's so very, very important, and resources are vital at this time. As important as resources are, what is clearly at the present time more needed than anything else are vaccinations. And the vaccination rates in the African American community lagged a bit, first and foremost, to a large extent, because of two factors. One, again, resources. Vaccination opportunities were not afforded individuals living in communities of color to the extent that they were elsewhere. But second, because of the history of this nation and because of the horrific racism that was part of medical experiments and forced sterilization of African Americans, as it was also done to Native Americans. This is our history, and it is having real impacts on the lives of people today. And so, in the efforts of this union to overcome long-standing institutionalized racism, we are conducting these panels and these conversations to begin the work that has to be done. And it is with that that I take this opportunity to introduce my colleague, one who has been on numerous UUP sponsored events, talking about the issues that she deals with at Downstate, but also given her amazing career in the medical professions. Dr. Camille Clare, who joins us from Downstate and will be our leadoff speaker today. And again, Dr. Clare, it's wonderful to have you on the program. It's great to see you again, and I'm looking forward to hearing your presentation. So please go ahead.
Thank you, Fred. I thought I wouldn't have to say anything. Fred gave my whole talk, so I appreciate that. And I'll hopefully made some comments which will be of value to our members. So this is a great opportunity for me, again, to speak to you about COVID vaccination. I became passionate about this topic sort of by default. Fred didn't mention, but I'm an obstetrician gynecologist by profession and training. I still do work in this area. So I've mostly spoken regarding concerns of vaccination in pregnant and lactating persons and those planning to become pregnant. But even what's more important and significant for myself as a Black woman physician doing this work previously in East Harlem for 20 years. So at the onset of the initial surge in March of 2020, I was working in East Harlem before I was recruited here to Downstate. I've done most of my work with the National Medical Association, which is the largest and oldest organization of African-American physicians in the country, 126 years old, founded at a time when Black physicians were not allowed to join the American Medical Association, were not allowed to admit patients to the hospital. So the impact of such issues is not lost on me throughout my career and in my years of service in medicine. So I think what we're here to talk about specifically during Black History Month, but not relegated to these 28 short days, but 365 days of the year, and hopefully that's not lost on this audience, is that we really have a strong part to play. So myself and Dr. Threatte will hopefully be able to answer your questions about these topics as we go on. So we know even before the vaccines were available, and I'm going to be sharing some data, and not to overwhelm you too much with numbers, but I think it's really important to think about. Less than half of Black Americans, African Americans, said that they were going to get the vaccination. And even to this day, it's a little over that amount. 55% or so have already received at least one dose, if not more. So we know that issues of concern, I hate the term vaccine hesitancy for many reasons, but we know that those issues are really, really concerning for many people. We know that African Americans were more likely to become severely ill and to die from complications of COVID-19 for many reasons having to do with the structural racism that Fred alluded to and the social determinants of health, which I know very well here in my role at Downstate and my patients have to face on a daily basis. Even though 12% of African Americans are in the population. African Americans account for about 15% of the deaths from COVID-19 compared to everyone. So that means a loss of 3 years of life for people that look like myself. So it's really important for us to not only talk about concerns about vaccination, but to be also speaking about vaccine equity, making sure that everyone who wants a vaccine is able to achieve it. So fair and just access to vaccination for everyone. And there are many challenges to that. We know that. We know at the time, again, as Fred alluded to, in March 2020, several of us were frontline, they distinguish frontline workers, essential workers. We're all a super important piece of the healthcare landscape. Every single individual is important in this hospital systems in which we work. I know this as a physician. I cannot do more than half of what I do without my colleagues around me every day, getting me the supplies I need, working with me hand in hand at the bedside. So that's really important. But many issues can impact why African Americans in particular may not have access to the vaccine or be concerned about it. We know what these social determinants of health are: education, their jobs that they have, the working conditions, racism is already mentioned, other forms of bias and discrimination, gaps in access to health care, transportation, neighborhood conditions. Most important, as Fred alluded to, a lack of trust based on not only past medical racism, but current medical racism and issues of experimentation, which were noted in my specialty in particular, obstetrics and gynecology. That's a talk for another day, but definitely these things are present issues. We're not talking about the time of the Tuskegee syphilis study in the 1930s and 40s, but present time, the 70s, the 80s, that Fred alluded to in terms of sterilization of African Americans and Native Americans, indigenous peoples against their will. Recently, a few years ago, hysterectomies performed by those who were detained by immigration against their will. We know, especially around the COVID-19 vaccination, a lot of misinformation. I think that's been the most damaging to all of us who are doing this work to talk to our patients, is misinformation and lack of appropriate information. So we really know that that's been a challenge that we hope to address for you today in answering those questions of how to really build that confidence. I love the term vaccination confidence, which I speak about every day, providing you today and hopefully in other sessions, clear, accurate information about the COVID-19 pandemic, infection, and the vaccination. It's very fluid. There's been a lot of information that's changed and developed and over the last 2 years that we're still learning about every day. Our goals is to increase awareness about the benefits of vaccination. I believe in vaccination. I encourage and strongly encourage my patients to obtain vaccination. And really, I hope to address some of your questions, your most common questions about the vaccination and your concerns so that we can answer them. That is our goal, so that you can make an informed decision. And we know that we have to adapt our messaging, our key messages, to our communities, the communities in which we serve. We want to remove those barriers to accessing the vaccine. So if you need transportation, if there are improved hours so you can get access to vaccination sites, that's really important. I want to be a trusted messenger, having a trusted venue, UUP. We're all equal UUP members. We're trusted messengers in groups that we can give you the message regarding outreach and distribution of the vaccination. We know that there are many reasons. Myself as a trusted messenger, as a physician, as a Black physician, as a Black woman physician, goes extremely a long way in, again, answering the questions that my patients have. We know that African Americans are twice as likely to trust the message regarding COVID vaccination if it's given by someone of their own racial group and ethnic group compared to being given by any other member of any other group. So African-American physicians are only 5% of the total physicians throughout the country. So we need more than just us. We need other trusted messengers to deliver this message. And we know that many African Americans played a huge part in the development and the administration of the vaccine. So that's very, very important. Many of our colleagues, many of our family members, our friends were in the initial trials regarding the vaccination. And we thank them for such a huge part that they played in the development to ensure that vaccinations are safe, that they're highly effective to prevent the spread of illness, to prevent hospitalization, and to prevent death. So we know that our community partners, other physicians, community-based organizations, UUP, all types of groups are super important in really helping us ensure that you're confident in making your decision to get vaccinated and that we have access to vaccination in minoritized communities, which is very, very important. At our workplaces, which many of us have given vaccination to our coworkers right here at the hospital, at community centers, at schools, at churches, at other faith-based organizations, barbershops, beauty salons, recreational facilities, restaurants, local stores, all of us play a key role. We'll speak a little bit, and I'm going to defer to my colleague in a little bit about more specifics. But for me in particular, I have to speak with an OBGYN hat every day, all day. We know that specifically for Black pregnant individuals, their rates of vaccination are much lower than other groups, 15% compared to only 30% of white pregnant individuals. So that means that's, again, a huge disparity, a huge gap that we wish to address and talk to you about. My patients are a part of their families. I was mentioning to Fred and the team yesterday that my patient was unsure about vaccination in her children, but because we had a trusting relationship, I've taken care of her for many years. She asked me my opinion. I don't even take care of children, but she asked me my opinion and I said, yes, I believe you should. I said, how old are your children? Are they over 5 years of age? She says, yes. And I said, yes, please go ahead and get vaccinated for them. And when I spoke to her later, she said, yes, I made that decision and I went to get them vaccinated because of the trust that we had. We have a trusting therapeutic relationship. She relied on me to give her reliable information. And if I don't know something, I rely on my colleagues, my pediatric colleagues, my infectious disease colleagues to give me the information. My colleagues rely on me if they don't know something specifically about pregnant persons, lactating persons, those who are attempting pregnancy. So we've worked together really to do these forums and to provide the information. So I'm going to divert it back to Fred and the team to speak to you a little bit further, but we'd be happy to answer your questions. Hopefully my time was appropriate. And it's really, really important that we answer your questions so that, again, you make the appropriate informed decision. And if you decide not to be vaccinated, and of course, we want you to make the better decision, we want you to continue to do those safety measures, despite what you're told about mask mandates, especially in the state. If you are unvaccinated, you still must continue to wear your mask indoors and outdoors. You must continue to avoid large groups and socially distance. You're not vaccinated. That means you're at increased risk. And you must continue to wash your hands, which are good infection control practices. But we want you to make that decision, that informed decision to get vaccinated. That is the message. Thank you so much, Fred and Patrick and Darlene and the team. And I'll turn it back over to my colleagues for additional thoughts.
Great. Thank you very, very much, Dr. Claire. Excellent information. And you closed on the perfect note. We urge people to be vaccinated. Anyone in the audience who has not done so as of yet, but then also so that everyone is aware in the UUP community, despite what the governor has announced, despite what SUNY is attempting to develop in terms of a policy with regard to mask wearing, UUP's position has been and continues to be that we favor mandatory mask wearing in the settings in which we work at our campuses as a necessary precaution with the realization, of course, that campuses may be given some discretion to go their own way on this. We think it's important for on our own to continue to make the decision to be masked, to protect ourselves and to protect our loved ones. So thank you again, Dr. Claire. I will echo what Christy Salmons, our executive director, posted in the chat in terms of questions. If anyone has any, please put them in the chat. We're monitoring that. And I don't know about you all, but I was taking notes on Dr. Claire's presentation. I actually developed some questions of my own. So, but I will get in line with everybody else. With that, I want to turn it over to our friend and our colleague, Dr. Gregory Threatte, who is joining us, who previously was part of the Upstate Medical Center community. And now, as far as I know, Gregory, tell me if I'm wrong, you're living in Albany. I know that you have real strong connections to the Capital District because many of us have benefited from being in your presence in advocacy trips back when we could go downtown. But now, again, I want to thank you very much for joining us today. And with that, I'm going to turn it over to you so you have as much time as possible to share your insights. So please go ahead.
Okay, I'm going to try not to take up too much time. I bring you my background and what I know about COVID stems from, I guess, 40 years of teaching medical students pathology. For 20 years, nearly 20 years, I directed the immunology laboratory at University Hospital at Upstate Medical University. And for the last 12 years, I was director of laboratories and chair of the department, which meant I was in charge to supervise the cytogenetics lab, the genetics lab, and the virology lab. So throughout the pandemic, I've been reading and trying to stay ahead of the game in this. However, my first slide, which was just up, I'd like to bring your attention to, can we see the first slide?
You got it.
Okay. I think the most convincing reason to be vaccinated is something I saw in a New York Times article only about a month ago. And this shows data from the last 2 months of 2021, showing the death rate in New York City, comparing the vaccinated, which is the lower bar, with the unvaccinated. Okay, now you can look at that peak and say, gee, not being vaccinated is hazardous to your health. You know, these are averaging the weekly death rates, but compare the area under the lower curve, labeled vaccinated, to the area under the upper curve, not fully vaccinated. If you're not vaccinated, you're taking a real chance on your life. And the lower part of the slide shows a similar phenomenon in Seattle, which wasn't, where the death rate wasn't quite as high. So comparing the area under that curve, to me, is about the most convincing reason I can think of for being vaccinated. You are, if you compare those areas, one is a small percentage of the other. Let's see the second slide. Now, this study was basically the last 2 months of 2021, which it was the Omicron variant was the prominent species. And as you see here, it was heading toward a peak in late December of 2021. But look at where the peak is. The peak is almost exclusively in the non-vaccinated. Looking at the bottom of that graph, the vaccinated looks a whole lot better in hospitalization. But over to the side here, it says this difference is actually falsely exaggerated, because if you look at the hospitalizations of the vaccinated, many of these people went into the emergency room with a broken leg or a car wreck or hit their head. And just the fact that they tested positive for COVID meant they were put in isolation. So this number of hospitalizations of the vaccinated is falsely elevated. And when you see the statistics of the vaccinated testing positive, you know, these are not people getting sick and hospitalized for COVID. I think just that comparison of the last 2 months of 2021 shows you the difference between being vaccinated and being very relatively safe and unvaccinated, where basically you're left susceptible to the really high infectivity rate of the Omicron variant. Vaccine is the single best thing you can do. Okay, you can take down the slides now. And the other thing I wanted to speak to, because you know, I want to leave time for questions, but the most common question I have been asked over the last 2 years have come from people when it challenged me about the Tuskegee Experiment and why this is why we shouldn't get vaccinated. Okay, now the Tuskegee Experiment was conducted from the early 30s until the early 70s. And in 1972, it hit the news and media and exploded. I was in medical school at the time. And let me tell you, we had panel discussions about the Tuskegee experiment. And in all the years that I was on the faculty, we repeatedly have had discussions on it. And I guess it brings home the point, if you don't know your history, you're very likely to repeat it. The Tuskegee Experiment was conducted on nearly 500 Black men. They were given care for what was called bad blood, while they were actually being followed and monitored for latent syphilis. The real crime in this study was by the late 40s and early 50s, when antibiotics that cured syphilis were widely available. The men were neither treated nor told about it. There were no vaccines involved in the Tuskegee Experiment, nor was there any other type of treatment given to the subjects of the Tuskegee Experiment. To me, that's just one early example of what we still see today, where a lack of access to healthcare occurs in poor communities and leads to healthcare disparities. You have medical deserts in poor communities because of poor Medicaid reimbursement rates. Okay, you hear politicians fighting against the Affordable Care Act that they call Obamacare, because it holds down access to healthcare insurance, which leads to an impairment of ability to access healthcare. But the thing that not bothered me the most was once the COVID vaccines became available, we began to hear QAnon, Fox News, anti-vaxxers, and other wacko social media platforms trumpeting, remember the Tuskegee incident, okay? The Tuskegee incident is arguably the most infamous biomedical research tragedy in US history. But in this case, it's being used as a false narrative. It's false because what happened in this study was not that people were given treatment or vaccines that were harmful, but that treatment was being withheld. And what I see is the media using the Tuskegee incident as a way of getting people to say, you can't trust experiments, okay? Don't get vaccinated because remember what happened in the Tuskegee experiment. And it is a false narrative and the total opposite of what occurred in the Tuskegee experiment. And I think it's important that we think that through because this is Black History Month. And those who don't know the history are likely to repeat it. And now I'm open to questions.
Great, thank you very much, Dr. Threatte, both for really showing the importance, I mean, we are in an academic setting, the importance of data and the importance of facts in terms of the true tragedy of Tuskegee in terms of what occurred, but how it's been manipulated. Also, I wanted to thank you. It's been a while. I don't want to admit how long since I first had calculus, but you reminded us all of something very important. We tend to fall into the habit of looking at points on those graphs and not paying attention to the area under the curve. You said that a couple of times. That's the important thing. That's where you see the massive difference in the cases in terms of hospitalizations. So thanks for reminding me of calculus from long ago, but a really important fact. So thank you for that. I did say that we were inviting folks to put questions into the chat, and actually I did have a question, but I'm going to yield to someone else who is in the chat, and that is Sandra Mingo. Sandra, if you want to unmute yourself, I would like you to state what you put in the chat and maybe expound on it. I think it's a great idea, and I know you caught Dr. Claire's attention. You certainly caught my attention as well. But if you just wanted to express that, and then we can give our panelists an opportunity to respond. Please go ahead. Hopefully you're still on. Oh, your mic is not working. Okay.
Perhaps I can take a stab at it, Fred. She was speaking about medical students sort of doing a physical landscape of the neighborhood to visit, to talk to individuals in the neighborhood about getting vaccination, as well as everyone benefiting from those conversations. And I think that is actually a wonderful idea. I used to, when I worked in East Harlem, I used to actually walk the community. I would go get lunch, I would go outside, and I think and my patients would see me. And so I think one, I couldn't eat the bad things because they would see me. And two, it really allowed me to get to know the neighborhood very, very well where I lived and really speak to people kind of almost where they are. And I think that's very, very important. And for students that may not be from the communities in which they're living, I think that's extremely, extremely important. One, it provides community members and neighborhood members a different perspective for our students. really sort of a lived experience for students to really understand, this is where I actually live. This is where I get my groceries. This is where I buy my food. This is where I go to school. This is where I work. So I think that's really an excellent strategy to be that trusted messengers that we spoke about. I know Miss Lewis had also put in the chat, I see her on the video, which is why I'm saying her name, is that she mentioned, how can we really battle the misinformation? There's so much information that's not really accurate out there. And so one, it allows us to develop that relationship with our patients, to be those trusted messengers ourselves, and really to be able to answer those questions in real time for individuals. Because the questions that I'm asked are very, very valid questions. They're very valid concerns. And I think really by able to take each question one by one, where one, be able to establish things that are not true, that are myths. For example, just this week before this presentation, I had a phone call from someone who's concerned about menstrual periods and vaccination. And before, I was asked this question in the past, almost a year ago, didn't have the data, didn't have the information, but I have it now. I have that information now. There have been up-to-date studies from the NIH that really allows me to answer that question for someone. So really answering patients where, the concerns that they have really, again, allows us to dispel myths. So things that are not true, we can say that's definitely not true. Things that we don't have data for, to say, whether we have data for it or not. And again, be able to address that. So I don't want to take up too much time in case Dr. Threatte wanted to add anything, but those are some strategies that I've used in talking to my patients and my members of my community.
Well, one thing sort of related to that is the whole question of fertility. There are people who believe that if the children get vaccinated, it's going to affect their fertility. There is no evidence of that whatsoever, and it's been studied repeatedly.
Yeah, I mean, that's a really great question, not only for children, but for adults, right? I've gotten that question many, many times, people that are planning to get pregnant. And so I think we have that information now. We definitely have that information to say that's not true. They've done studies in people who've tried to get pregnant, people who are attempting to get pregnant, no difference in their ability to get pregnant. We have that specific data. So for children going forward, no evidence that's going to affect their ability to have children later on. Does not cause sterility at all in young women and young men. Does not. I can definitively say does not. And again, when I don't have the information, I tell patients that too. If I don't have the data, as I mentioned several months ago, 6 to 8 months ago, I didn't have the data on menstrual periods. I have it now. So I can definitely clarify that for people right now. So
and from the earliest days of the pandemic, getting COVID while you're pregnant has been a disaster. I mean, okay.
Not only in the early days, up to today, more deaths, more hospitalizations, more ICU admissions, more likely to be placed on the ventilator. We've lost, I think the numbers are something like about 200 mothers, 200 parents to COVID, which means loss of parents for children that are orphaned by both parents that have passed away. So good question by Darlene. Do I recommend, is it when do I recommend or do I recommend? So do I recommend, do I recommend pregnant people to get vaccination? The answer is yes. I also recommend at any time during the pregnancy. So it can be in the first trimester, the second trimester, and the end of the last trimester, the third trimester. And the reason for that is just what I mentioned. We want you to avoid getting the illness so that you don't die, that you're not admitted to the hospital, that you're not in the intensive care unit, you're not placed in a mechanical ventilator. So that's the reason why we recommend. And also there's benefits to your unborn child. There are antibodies that have been found in the placenta. Dr. Threatte's a pathologist, that's been found in the placenta for those parents or those mothers. I'm using gendered language, but you know what I mean. For those pregnant persons to get benefit for their unborn child that can be vaccinated at the time of birth. So that's why it's so important during pregnancy to get vaccinated.
Thank you. There's another question here by Carolyn Cube. She would like you to expound on adolescent girls and having irregular cycles due to COVID vaccine. True or not true?
Yeah, so what they found actually is that there were slight irregularities. I think it was a difference in about a day or so in the length of their cycles, but very insignificant length. So much shorter cycles, maybe a day or two longer with the vaccination, but that went away. So it has not been borne out. If there are other reasons for irregular periods, it may be something else, but not related to the vaccine. And we have studies that have proven that. There was a huge study looking at about almost 4,000 patients. So we have a lot of good information, a big study that really gives us the information. We didn't know that before, but we do know that now. Not a big difference in those who've gotten the vaccination on their periods. But thank you for that question. It's a really common one that we're asked about a lot. So thank you for that.
Fred, what was your question?
Oh, thanks, Darlene. I had two. I'll try to combine it into one. Dr. Clare, you mentioned pretty early on in your presentation, you referenced the social determinants of health, which I just wanted to give you the opportunity to expound on just a bit, although you touched on it. I think it's a really vital concept, and it's a policy as well. It's a policy idea in terms of addressing funding and Medicare funding, Medicaid funding, and Dr. Threatte mentioned that as well in terms of deserts, healthcare deserts. So if you could to just give a little bit of a background for everyone on the audience, especially those without a health background, about the importance of focusing on social determinants of health. And then part two, it's kind of related, is how both of you have seen the impact on healthcare professionals, their emotional well-being, given the stress that they're facing with the patients. And that is part of the vaccination equation, if you want to use it, that unvaccinated individuals are creating a worsening circumstance for our healthcare professionals. So I just opened that up for you to address as you'd see fit.
Why don't I start, and then I'll pass it on as you see fit. So I think, so what we mean by social determinants of health is so where people live, where they work, where they attend religious services, how they get transportation. And very often when we describe those things, it can sometimes lead to differences in health outcomes, right? And stresses and illnesses. But what we don't talk enough about is where those social determinants come from. They come from policies and procedures that have been established during the time of those of us who were enslaved, structural racism, gender oppression, gender inequities that have led to those things. So here's an example. Redlining, for example. Certain communities and neighborhoods have been under-resourced, have not gotten resources to, it was based on, and Dr. Threatte and others can let me know if I'm incorrect, World War II veterans, when they came back from the war, they wanted to get a bank loan to buy a home. Home ownership is economic improvement to your family, and were denied loans because they were African American. And as a result, were relegated to certain neighborhoods. Those neighborhoods were ultimately under-resourced. They continue to be under-resourced. They affect the hospitals that patients can go to because they're in certain neighborhoods, certain specific areas, safety net hospitals, so to speak. And so that is a factor that has led to those things. So people just don't say, well, I want to live in this particular neighborhood where I don't have access to food, where I have housing instability. They don't make that choice. Those choices have been made by those policies and procedures. So that policies and structural factors that have happened. So you spoke about access, and that's super important. So by us really advocating for equity, really making sure that patients know where to get a vaccine. Sometimes it's not that people don't want to get it. They don't know where to go. It's not at every single corner. Like they may not have access to internet to be able to look up and see where to get their vaccination. They may not have access to that. So us being able to provide that information to open up that access for them so they know where to go is what's really important. Because sometimes it's not that they don't want to receive it, they just don't know where to obtain it. And that's our job, to help them obtain it. So I'll take a pause while others speak to answer that for you.
Well, I would add to that, yes, there are structural reasons. I've had uncles, father-in-law who were in World War II. And trust me, the GI Bill did not apply to them when they returned. Okay. My father-in-law died in 2005. We still can't get the VA. My mother-in-law died not getting support from the VA. The application is still out there. And that's in spite of the fact that my father-in-law was a sergeant, was in charge of the police force on Guam, and honorably discharged. What happened after World War II for white soldiers returning did not apply to Black men, and the records are still distorted. Now, one thing though I'd like to point out that we should be aware of, and that is Black men somehow has been pounded into our heads that seeking health care is a sign of weakness. Okay? Women will go get pap smears, breast exams. Getting Black men to do anything on time is practically impossible. Okay? And even I've known Black men who, even when they were diagnosed with prostate cancer, refused to be treated. Okay? And so when the vaccines came along, well, hey, remember Tuskegee incident? We can't get that. I think we have to take special care with Black men that you're not helping anybody by avoiding health care.
I think to speak to that, I think that's why I think as Black physicians, we have such an added responsibility, and specifically for the Black male patient perspective, it's been shown that Black males who have a Black male doctor are more likely to get those interventions than anything else. They found that for hip replacement. They found that for some interventions for heart disease. So we really, that's why it's so important for us to be on this panel to speak to people, not only, as I said, Black History Month, but every day of the week, because we really, really do play a huge part in people making those decisions, because for many of us, we are that trusted messenger. And I don't want to not capture some of the questions that are in the chat about immigrant communities. I think it's hard to separate immigrant communities from their racial and ethnic background. I think in terms of navigating the systems, that can be a challenge. I know we take care of patients, about 40% of our patients are born in other countries. So I think being able to help our patients navigate these systems that can be extremely confusing, even if you weren't born outside of the United States, how to get this done, how to get that done, how to get here and there and there. It's very confusing. So I don't know that data specifically about immigrants, whether having more vaccination or less. If Dr. Threatte knows it, please let me know.
Well, all you have to do is look at the intimidation of the previous administration, where the Immigration and Naturalization Service was going around arresting people, and the president was attacking, what they call sanctuary communities. If you make people afraid to be noticed, because if they get noticed, they might get deported, then people don't get health care.
Yeah, that's a really excellent point. I think that's really played a part in people's fears of getting care. And then Darlene had a question about the side effect, the side effect in the heart for male patients. It's called myocarditis. And so my understanding, and I read a little bit about it more yesterday, is that it's quite rare for that particular side effect. And even my pediatric colleagues who's asked about it very often in children, it's been quite rare that male patients have received myocarditis from getting the vaccination. It is a good question, but very few have received that. And then the other good thing about the vaccination system is that they have this V-Safe registry, so that all of us that have gotten vaccination, they check on you, right? They check on you within several weeks after you've gotten your doses, so that as anything that has happened, anything as small as pain in your arm or a headache or anything, you report those things so they can capture that, so we can learn a little bit more about it. And the cost of the vaccination is free. It's 100% free. Sometimes they ask you for your insurance card, but it's not, there's no cost to you to obtain it, whether you get it from the pharmacy or you get it from the hospital, no cost to the vaccination, free. You don't need an insurance card. You don't need to anything like that to get it. It's free.
How do we get our students to get vaccinated? Because I think that's one of the biggest issues. They're young and they feel that nothing's going to happen to them and they're not taking it seriously. And I thank you, because my cousin died. He had prostate cancer. He did not take care of it. And yeah, so he denied that issue. And he was a very young man too. So thank you for bringing that.
Sorry to hear about that.
Yeah. College kids think they're immortal. Nothing will ever harm them. And I thought I was immortal when I was 22, 23 as well. I mean, the thing is that we have to be persistent in demanding that they protect themselves.
Yeah.
Go ahead, Darlene. Yep.
Comment that's in the chat. I know they both are reading it, but in essence, this person had a reaction to Pfizer. She wants to know how to navigate the healthcare system. And my cancer doc said I had an over-immune response. It lasted for 6 months and crazy things happened to my body. I'm still pro-vaccine, but found that doctors didn't know what to do with me. What about people that don't know about how to navigate the system?
Yeah, I think those are very good questions. And remember, the vaccination was available to us over a year ago. So I think over time, we've learned a lot of things since the original doses. Actually, December of 2020 is when people started to really obtain. So I think there's a lot of more information about, again, through the V-Safe system, the registry system, in order to be able to document what's going on. In terms of navigating the system, at many different hospitals, they may have what's called peer navigators, or individuals that can help you, or patient advocates, they're called, individuals that are not medical professionals, but are there in the hospital system to help you get access to different services. Sometimes it happens through social services or social workers or case managers, those kind of individuals. So one is that you can speak to your healthcare professional, right? So your physician, your doctor, to say what the concerns are. And very often we help patients navigate different things, make calls on their behalf, get appointments for patients, working with our team members. So that's a strategy that you can use to get the help that you need, in order to figure things out. Because again, even for myself, and I'm a physician, if I go to a system that I don't know, I have to call, I have to get help. So it's not bad to get help. It's just a matter of making sure that you ask for help, and so people can help you navigate for the things that you need. So thank you for that question. That's a very good question.
I think we have concluded the number of questions that were presented. I'm just so taken with how this was presented and what you shared. Let's take 2 minutes to close out because I know everyone's busy. Dr. Threatte, you go. I know you said your name wrong, Dr. Threatte. You go first. You got 2 minutes, and then we'll follow with Dr. Claire. Okay? All right.
Well, I would like to emphasize that one thing COVID did was expose healthcare disparities in this country. Okay, and put it on a life and death level. The first 6 to 8 months of COVID, New York City was, the focal point of hospitals overrunning. That has just merely spread. And it was clear in the first 6 months that it attacked poor communities. My opinion is politicians wanted to take advantage of that. And, the whole resistance to masks started back then. But now it's out and open. Now is the time that we need to organize and deal with healthcare disparities. And I think the union is a good instrument for doing that because we all have families.
Yeah, thanks for the opportunity. And to speak to Fred's point, which we didn't get to that much, but I think it's really important for us to take care of ourselves. Self-care is extremely important as healthcare professionals and people who are working in a variety of systems in education. We've all been challenged by a lot of different stressors in the work that we do and in the environments that we work, and really dealing with a lot of misinformation and resistance that impacts for sure how we feel about the work that we do, but really continuing to speak to each other, getting the help that we need. If things are too overwhelming, if there are ways to take a step back from the work that we're doing. We know there are shortages in the healthcare workforce. They will continue to do so, which is why education is so important. We need to continue to foster the next generation of healthcare professionals. And so self-care is important. Taking care of your families, taking care of yourselves is really critical. And if you don't learn anything else from this whole talk, get your vaccination, wear your mask, wash your hands, still continue to avoid those large crowds, especially if you're unvaccinated. So I really appreciate the opportunity to spread that message. Get your vaccine and let us know how we can help you get that if you don't know how to do so.
Thank
You're muted, Darlene.
I keep doing that. Fred, you have the floor.
Thank you. Very briefly, I just want to thank our panelists, Dr. Threatte, Dr. Claire, joining us today, and for providing us with so much information. I want to echo what Stacy Johnson posted in the chat. Yes, I learned so much, and that is a testimony to the amazing ability that both of you have to present. So Camille, Gregory, thank you so much for this time. To all of us who were lucky enough to be a part of this, we do have an opportunity, we really do, to make a difference in the lives of those whom we encounter on a day in and day out basis, with whom we work, with whom we live. And that is what is so vitally important at a time when our humanity is really being challenged by the world around us and the environment around us. And yet we can make a difference. And I salute those who are trying so hard to bring healing, to bring wisdom and knowledge to our communities. And that goes for everybody on the call who is presently working at a SUNY campus as a member of UUP, and definitely to our two panelists, Dr. Claire and Dr. Threatte, for the work that you do and the message you have shared today. Thank you very, very much. And with that, I'm going to turn it back to my esteemed colleague and longtime friend slash sister, certainly a union sibling, Darlene Mayers. Darlene, go ahead. You can wrap it up for us.
Okay, thank you all. This again was a wonderful opportunity to hear some information that we may or may not have known. I've learned so much. I just want to say that for those who took the time to be a part of listening to this forum of educators, how proud I am to know that you are UUP and you are SUNY employees and have been instrumental in providing such incredible information. So thank you. You've given me some thoughts that I have to defend personally, because there are a lot of people in my life that just will not take this vaccine. And so now I'm fortified. So I just want to say thank you so much, and to round of applause to you both. God bless you, and keep on doing what you're doing. Don't give up, okay?
I was not only a SUNY employee, I graduated from Upstate.
Even better. Okay, shows you the quality of what SUNY education will provide. Thank you, Dr. Threatte. Thank you, Dr. Claire. Blessings in your future endeavors. All right, so my only thing I would like to say is this is our second event. Our last one will be next Tuesday. The topic will also be a little bit about health. The topic will be health, economic, and environmental justice for healthy communities. So that will also be Tuesday. Registration in advance is helpful. If you want to share this with other people, please let them know. And if you're interested in joining the Diversity, Equity, and Inclusion Committee, please speak to your chapter president and/or contact Patrick or myself, okay? So with that, enjoy the rest of your day. You all were super for being with us. Just have a great day and use this information to encourage someone else to get vaccinated. Bye-bye.